Good day. I am H. Robert Silverstein, MD. I'm a cardiologist with extensive practice, and I was supposed to do a little intro so somebody else could pick up this tape. I've been in Hartford since 1972. Been practicing at St. Francis Hartford Hospitals, and I have an assistant clinical professor of medicine position at the University of Connecticut School of Medicine. I'm in solo primary cardiology, internal medicine practice and enjoying it a lot. The old gray mare ain't what she used to be in several senses. I definitely move a little slower. Sometimes I think a lot better, but you know, we always justify ourselves that way. And I've slowed down in taking, and therefore take more time with my patients. I used to feel the crush to see the next patient, see the next patient. I've sort of slowed that down in the office. Obviously, there's a cost to that because the fewer patients you see, the less your income is. But it's not that I'm so entirely economically secure, and as I always said about my son Steve, send millions fast to our preventive medicine center so that I can continue to bring you these shows, entertain you with fabulous information, and at the same time provide this service to West Hartford community and cable access TV. And I hope you find it worthwhile. As you notice, I'm not wearing my Burberry shirts and ties of late. That's a little sign of laziness on my part. I even forgot my stethoscope today. So anyhow, let's get to the show. A couple of things I want to talk about. Passover is upon us, and this was given to me. This is Shmura Matzah. And what Shmura Matzah means is it was watched. The whole process was observed in its making so that it's certainly kosher for Passover. This was given to me by Rabbi Gopin of Chabad House. This is the nice package that it comes in. And as you recall, this is the same time of year of Easter, which many people think that Christmas is the major holiday for Christians. Easter is the concept of the rising of Jesus after his crucifixion, and that proves the three portions of God, the Father, the Son, and the Holy Ghost, and that makes Easter the most important part. Now, there are different religions. There's Orthodox, and they celebrate Easter at a different time, and I even think there are within that church different divisions. But regardless, this is a time of spring. This is a time of, I do believe winter has finally gone, although apparently we narrowly missed a very big snow. I wish everybody happy holidays. I don't know if there is a Muslim or Hindu or Sikh holiday at this time of year, but I suspect that there is something. All the religions seem to mark the seasons with certain holidays. Princess Summer, Fall, Winter, Spring, as so to speak. Yes, that's from Howdy Doody, but the concept is the same, the four seasons. Now, a couple of ideas. Today I was coming here to record the show and was listening to what my son calls National Communist Radio. I must admit, they're very weak on their interviews. They just let people get by with all kinds of nonsense. They don't grab the opportunity to push right or left. Like I say, their interviewing technique is very weak and they deserve strong criticism. Of course, I feel somewhat the same about the other channels on cable and radio. Actually, I don't listen much to radio except on the way to work and home. All right, enough of that. We're going to talk today about risk regression to zero. Now, this is such an important point that American medicine, I'm distracted here by looking at my image, which is straight in front of me, and the camera is slightly to my left, so I have to turn to the left to look at the camera, and yet my image is straight in front of me, so I end up being a little distracted. Please forgive me. Now, risk regression to zero. Here's a concept that I would really like the public to get. Diseases are, for the most part, made to happen. So let's shorten that sentence a little. Diseases are made to happen. Now what's the next sentence? They can be made to unhappen. Now there's no such word as unhappen, but it gets the idea across by grabbing hold of the key word of the last sentence. Diseases are made to happen. Diseases can be made to unhappen. Now, how do you do that? Bear in mind, I'm a cardiologist, but what I say also applies to oncology, likely neurology, endocrinology, et cetera, et cetera. There are exceptions to every rule. I'd like to comment about a program on NPR that I was listening to on the way here, and it was about the role of big media and Facebook in particular. Apparently the shooter in New Zealand, who killed 50 Muslims at a mosque and injured more, had it live on Facebook as it was actually happening. Now the question gets to be how much restriction of what goes on to Facebook should there be? And there is no circumstance in which there is not someone observing that proper behavior is maintained wherever. In movie theaters, if you act up, you're thrown out. You can't, the proverbial is you can't shout fire. Free speech is limited by being unable to shout fire in a crowded theater when there is no fire. As so on and so on. And so I do feel that there should be some obligation of Facebook to monitor circumstances wherever. On the other hand, it is very clear that Facebook is taking a very leftist position, which I, as a leaning left liberal Democrat, strongly oppose what Facebook is doing in getting rid of those on the right and who have opinions that might be called conservative. I would say that the current progressive program is pro-regressive. The current far shift to the left is absolutely very regressive. So anyhow, going on, risk regression to zero. That is, what value is it where the disease does not occur? Now, you might say, well, what are you talking about? Well, there are things like blood pressure, and cholesterol, triglycerides, even kidney functions, BUN, blood magnesium, homocysteine, cardiac C-reactive protein, diet, exercise, and so on. What's the proper diet? What's the proper exercise? What's the proper percent body fat? Well, wouldn't you know? Now, oh, I'm such a great doctor, I'm such a great thinker, I'm so far ahead. Look, I'm just being funny. The Preventive Medicine Center has a series of numbers called wellness protecting numbers. So if you Google my name, H. Robert Silverstein, you'll find a link in Google to the website, which is that of the Preventive Medicine Center. Now, there are several preventive medicine centers here in the United States, so that's why I tell you to Google my name, H. Robert Silverstein, find the link, www.thepmc.org. We are a 501c3. Once again, send millions fast for the great service that we provide you. So, and those wellness protecting numbers are for the simultaneous prevention of multiple diseases. In other words, we are talking lung cancer, colon cancer, pancreatic cancer, diverticulosis, much arthritis, anxiety, depression. I was actually going to change the topic today to about depression and talk about my take on the increasing incidence of depression and anxiety in young people going forward. So obviously high cholesterol, high triglycerides, diabetes, open heart surgery, not Mick Jagger's type. By the way, Mick Jagger did not have his open heart surgery in England, the socialist state. he came to the United States, where the free enterprise capitalist system has provided superior medicine. So anyhow, risk regression to zero. Now, I've got a little handwritten paper that I want you to see, and what it's going to show you is what's called a curve. It's a straight line, but it's called a curve in medicine, and it has to do with the number where if I give you a sugar load and measure your sugar 2 hours earlier, there's no incidence of heart disease. That's risk regression to zero. Well, that number is, if I give you a sugar load and I measure your sugar at 2 hours later, and your blood sugar is 85 at that time, you have no risk, no future risk of developing heart disease as far as sugar goes. That does not apply to smoking. It does not apply to cholesterol and triglycerides. We're only talking about sugar now. Well, if the sugar value that they measure from that same sugar load at 2 hours comes back 95 or 110 or 140 or 180, your risk of heart attack goes up. But I'm not interested in 180, 140, 85, and so 95, and so on. I'm only interested in 85. Give you that sugar load, your blood sugar 2 hours later is 85, is where risk regresses to zero, where no disease is made to happen. Therefore, it unhappens. Well, the same is true of cholesterol. And the wellness protecting numbers on the Preventive Medicine Center website show you where risk regresses to zero. What blood pressure? Well, for the vast majority of people, a blood pressure of 110/60 is the correct blood pressure. Not 120/80, not 140/90. 110/60 is where risk regresses to zero. And what about cholesterol? Subtract the good cholesterol from the total cholesterol, and in that number is 90 or less, then that's where risk regresses to zero for cholesterol. And then there's triglycerides. What about triglycerides? Triglycerides should be 100 or less. And that's where risk regresses to zero, and hardening of the arteries and pancreatitis are not made to happen. They are made to unhappen. And the same thing goes for the other numbers on that wellness protecting numbers from the Preventive Medicine website, www.thepmc.org. The PMC, Preventive Medicine Center, thepmc.org. So that is a major concept that most people in American medicine don't even recognize or accept. That is the simultaneous prevention of multiple diseases. There's the picture. See, that shows you the glucose load. That's hand-drawn. What do you think? I'm a great artist? That's actually pretty good for me. So heart disease on the left starts to increase when it's above 85, when it's 95 or 110 or 140 or 180, as the blood sugar goes up at that 2-hour point after the sugar load. So the sugar load is where those two lines cross. That's where risk is zero. And if the blood sugar comes back 2 hours later at 85, you have no incidence of heart disease. You have zero incidence of heart disease from your sugar metabolism. Now, the same thing tends to be true for an A1C of 5.5 or less at age 55. It should be in the 4s when you're in your 20s, 30s, 40s, and then at age 55, it should be 5.5 or less. And then it stays your age with a decimal point in the middle all the way up to age 62. So at age 60, your A1C should not be above 6.0. Could be lower, but should not be above 6.0. And at age 62, it should not be above 6.2. And at age 65 or 70 or 80, it should not be above 6.2. So it's your age from about the age of, say, 45 to age 55 should be in the 4s up to 5.5, and then not above 6.2 after age 62, and so on. Now, who else says this? Nobody else says this. Once again, oh, I'm such a great doctor. You realize, I figured this out on my own, which means, obviously, it could be wrong. And I tell my patients that you should think when you come to my office whether I'm nuts or I have insight that other doctors don't have. And it isn't like any patient is obligated to believe everything I say and do everything I say. As I've said before on this show, everything I say to my patients is an invitation to consider, but yes, I do give a little push. One of the disappointing things to me at this point in my practice is a patient who's going to send another person to me, and they warn the patient about what I'm like. What a terrible send-off. What terrible public relations. Look, I give a little push, support, help, determination to kind of clear the air, but it isn't like you perform for me. This is all about your freedom. Your freedom from seeing doctors, using medications. By the way, it's not about thyroid, even though I have most thyroid conditions. I have no idea what causes people to become hypo or hyperthyroid. Yes, maybe it's something they do, but I haven't got a clue about that. Multiple sclerosis and rheumatoid arthritis, I think I understand their origins. And the origins of many conditions begin with what you eat, affecting the microbiome, the bacteria that are in our bowel. Now, I just read an article today, and I can't quite pull it up, about how the microbiome in the intestine determined whether or not people developed whatever it was. Maybe it was heart disease or something else, but the bottom line is that's the way so many diseases occur. What's the bacteria in the bowel secrete these chemicals that penetrate the bowel wall and or simply go into the circulation by absorption like food, and they get into our circulation, and they either stimulate nicely our immune system or they anger it. And when they anger it, that's when the body gets confused and starts attacking itself. And that is the classic model for rheumatoid arthritis or multiple sclerosis, or etc. Now, with regard to cholesterol, yes, that's part of the picture for cholesterol and heart disease, but the other part is simply there's this load of cholesterol that's floating around in the blood and it starts to penetrate the blood vessel wall, and that invites these immune cells to come in and gobble it up, and in the process they become angry and other chemicals come, and that starts the hardening of the arteries process. Well, anyhow, enough of that. Let's change the subject entirely from risk regression to zero. Diseases are made to happen, and they can be made to unhappen. There was an article published recently that wasn't a perfectly done article, but it's another brick in the wall, a phrase I use commonly, about prolonged antibiotic treatment having absolutely no effect on people's mental decline after having had Lyme. And there are those people who believe that prolonged antibiotic therapy makes a difference, and I'm not one of them. However, some patients swear by it, and you don't know whether they've gotten a placebo effect or the real deal, but it is still unsettled territory. I lean in the direction that prolonged antibiotic therapy is not of value in Lyme, Babesia, and Ehrlichia. By the way, if you think you had Lyme and you're going for diagnosis, there are 3 tests to order. There is Lyme, Ehrlichia, and Babesia. So you want to get tested for all 3. Lyme is number 1, and it's probably adequate for most people's testing. Now, what do I have here? Oh. There's a class of drugs that is starting to make its way into more accepted treatment of hardening of the arteries and thinning of the blood, and they're the PDE inhibitors, of which Pletal or cilostazol, also Trental or pentoxifylline, have proven very helpful in making all kinds of improvements. So that addition to aspirin is very powerful at improving lots of things. I am not on Pletal. I'm not on aspirin because it upsets my stomach. And thank God, so far, no heart attack, no stroke, and no TIA. So what would I do if I had a TIA or if I had angina? I would start using Pletal, cilostazol, along with my aspirin and other medications appropriately. That's one down. Low-calorie diet with a daily meal shake may suit some type 2 diabetes patients. The shakes, smoothies, are actually a pretty good idea. They're filling, and if they're made correctly, without a banana, without yogurt, if they're made correctly, such as with pomegranate juice, which is full of strong antioxidants, and I think you should buy your pomegranate juice from the refrigerated sections. I'm not sure whether the antioxidants are still present in that stuff on the shelf, but I tend to believe, I have no proof, tend to believe that the stuff in the refrigerated section in that curvy bottle is better for you. Let's see, where was I? I was at Apple Tree on Prospect, on New Park. And they had a pomegranate juice that was in the refrigerator. And so, I bought that thinking, well, that's probably the same thing. I don't know that it is. The prices at Apple Tree and Aldi are really quite a bit less than most grocery stores. I've been told ShopRite is also less expensive. Some people don't like to go to those places. I don't know why. Food is generally cheaper at BJ's. So finding the organic food, which is better. They don't have much organic food at Aldi or at Apple Tree. They have a fair amount at BJ's and obviously more at Trader Joe's, which has become a favorite of mine, along with Whole Foods. The problem with Whole Foods is that it's simply too expensive. They have reduced their prices. Okay, I'm getting a high sign of 5 minutes. All right, what, have I gone on too much today? What do you think? I should get off the air and quit this job and get fired and so on and so on. 5 minutes or 5 seconds?
5 minutes, keep going.
5 minutes, keep going. So anyhow, smoothies. Smoothies could be made with pomegranate juice, and I like the spring mix. Now, Whole Foods has a spring mix with herbs, and I think that's even better. And why do I like the spring mix? One of the mistakes people make is they do the same thing all the time. The spring mix is a wild variety. It's got like 15 different plants in it. And when you add the herbs, you get some really good, more potent antioxidant contents. So you get the spring mix, the pomegranate juice, you throw in some berries, which have come close to room temperature or cool. Do not put ice in the smoothie. Do not put yogurt or milk in the smoothie. If you want to put some almond milk or rice milk or hemp milk in it. And then do put a flavorless protein powder, not whey. W-H-E-Y. Whey is milk protein. And yes, there are some benefits to it, but I think forgive me, I think milk products are the most dangerous food. I think milk products are the most dangerous food. I think milk products are the most dangerous food. No, the record was not broken. I'm trying to make a point. I think milk is more dangerous than any other food from multiple standpoints. Predisposition to colds, breast and prostate cancer, any ear, nose, throat problem, too much wax in your ears, recurrent sinus infections, recurrent sore throats, bronchitis, bunions, I believe are related to milk products. By the way, I've seen this interesting thing on one of the websites I go to. One of my favorite websites is Quora, Quora. You ought to come to Quora and ask me a question. All kinds of people are asking me questions. Yesterday I was asked, what happens after you achieve a goal? And I said, that's yesterday's news. Now what are you going to do with that goal that you achieved? That's the real deal. And I thought, oh boy, is that so even-handed, my highest compliment. So I get to give myself my highest compliment. I know, oh, I'm so smart, I'm such a great doctor. Anyhow, going on. So, so you have these smoothies, which are made with berries, the greens, the almond milk, rice milk, or hemp milk, and the scoop of hemp protein. That was the only one I could find that was unflavored. Yes, it's a little bit chalky, but you've got the other things to flavor it. So you get yourself a nice mixer. You don't have to go out and buy a Vitamix, but there's nothing wrong with that. By the way, I have a hard time with the Vitamix soups. They're all the same. They're pea soup. They're blended. They're smooth. I sort of want to recognize some different vegetables and so on and so on. In my soups, I don't care if they're thick or not. As a matter of fact, I recommend thick soups. By the way, those of you who are lean and trim, the most filling vegan food is, by the way, vegans are my healthiest patient. They have risk regression to zero and all the things I was talking about. Perfect non-HDL cholesterol, perfect triglycerides, perfect uric acid, perfect BUN, perfect blood pressure, and so on. So I believe that being vegan is natural for our biology, plus the fact, take a look at our teeth. The fact that we have a salivary, you don't have to be 100% vegan. 90%, getting an A will be just fine. Animal protein, 2 times a week if you are trim, once every 10 days if you are not trim. Okay, what's that? What's happening now?
1 minute.
1 minute, okay. So it's wrap it up time. I hope you found today of some value. I didn't get to discuss Beto O'Rourke, John Francis or Francis John, but I'll say this, the man fed feces to his wife. He also, I don't know, committed some DUI arrest. You know, it goes to character. You can say that was then and this is now. His bullismus really impresses me. No wonder he's so thin. He's exercising all the time. So all we have to do to get down to his weight and percent body fat is walk around like this all the time. And truthfully, it'll work. Okay, that's it. Hope you had a great time. H. Robert Silverstein, MD, for the Preventive Medicine Center. Good day and God bless you all.